It is estimated that 25 million Nigerians live with one form of disability or another.
Every day we deal with stereotypes, we are excluded, and we face discrimination.
The COVID-19 pandemic, since its first appearance in Nigeria, has heightened inequality and increased the marginalization of vulnerable communities. People living with disability were one of the groups most affected.
During the pandemic, I struggled to do things on my own since we were to keep social distancing, and it became very difficult for me. For me, I have an underlying ailment, so it was very important for me to completely stay away from people. And if you understand what that means, I will practically do everything by myself. So it was a struggle. I struggled to go to the market, I struggled to get water and all of that. In developed countries, persons with disability during the COVID-19, foods were brought to their homes. We are not having this done in Nigeria because we do not have disaggregated data. The Nigerian government does not know where persons with disability live, because if that was applicable here, foods would have been brought to my doormat without me even knowing who dropped it.
COVID-19 taught me that as a country, we are vulnerable to infectious diseases outbreaks. Preparedness is an important part of any outbreak response, and having an emergency public health preparedness and response fund can help provide adequate funding for epidemic preparedness and fix the access to healthcare gaps for persons with disability like me.
Persons with disabilities cannot and should not be left out in crucial information.
When we don't recognize diversity and persons with special needs during outbreaks, we limit the effectiveness of our response efforts.